Hello, my name is Badjo Tete, and this is my case study for my HAP 725 Statistical Process Control class at George Mason University. Throughout this presentation, we're going to look at a few control charts to assess Hackensack University Medical Center's performance on select measures and compare it to surrounding hospitals. The hospitals we are going to be comparing Hackensack University Medical Center to are the Valley Hospital, Englewood Hospital, and Morristown Medical Center, which are all located in New Jersey. According to Google ratings, Hackensack University Medical Center has the highest rating of a 4.2, followed by Englewood Health, Morristown Medical Center, and lastly the Valley Hospital. The data source used to complete my analysis was data.cms.gov, which is an open source platform containing various free hospital and healthcare related data. Let's first address the limitations encountered during the case study. 5 significant factors constrained our analysis. Firstly, our dataset only extended up till 2020. Secondly, data from 2013 was unavailable for some key measures. The demographic information of the individuals from whom the data was sourced remains unknown. There were limited measures to choose from. And lastly, we acknowledge a 5% error rate in our findings. The measures I decided to focus on in this case study are in-hospital fall with hip fracture rate, post-operative hemorrhage or hematoma rate, post-operative acute kidney injury requiring dialysis rate, post-operative respiratory failure rate, and post-operative sepsis rate. This is our control chart, a graphical representation of the in-hospital falls with hip fracture rate over time. The chart allows us to identify trends, variations, and potential areas for improvement. Now let's focus on the yellow lines you see on the chart. The UCL, also known as upper control limit, signifies the maximum acceptable performance level. If the data points breach this upper boundary, it indicates an unusual spike in the hip fracture rate. The LCL, also known as lower control limit, represents the lower threshold of our expected performance. Falling below this line is actually a positive sign, indicating a lower rate in hospital falls. The green line represents the mean of the hip fracture rate over time in Hackensack University Medical Center. In this graph, we see a spike and a drop in the in-hospital falls with hip fracture rate. As we see, the fall rate is below LCL, showing a positive trend in patient safety. This is the control chart for post-operative hemorrhage or hematoma rate. It shows a decrease and leveling out, indicating a stabilization in performance within the established control limits. The consistent trends within these limits suggest the efforts in managing post-operative hemorrhage or hematoma have been effective. This is the control chart for post-operative acute kidney injury requiring dialysis rate. It shows a slight increase followed by a rapid decrease, ultimately remaining within the control limits, also suggesting ability to promptly address and manage post-operative acute kidney injury requiring dialysis. This is the control chart for post-operative respiratory failure rate. It demonstrates a significant decrease from above the UCL to touching the LCL, followed by a gradual rise. The initial decrease signifies improvement, while the subsequent upward trend suggests a need for continued monitoring and potential intervention to maintain the positive momentum achieved in reducing post-operative respiratory failure rates. This is the control chart for post-operative sepsis rate, showing a decrease to below the LCL. The decline in post-operative sepsis rate signifies success in the patient safety measures. In conclusion, Hackensack University Medical Center exhibits a concerning rise in the post-operative respiratory failure rate. However, positive trends are evident in metrics such as in-hospital fall with hip fracture rates, post-operative acute kidney injury requiring dialysis rate, and post-operative sepsis rate. And the post-operative hemorrhage or hematoma rate remains stable. Comparatively, the medical center outperforms competitors, staying within or below control limits in all measures. Despite challenges, the favorable comparisons indicates effective risk management. Here are a few recommendations to possibly bring down the number of post-operative respiratory failures. Early mobilization. You could encourage early post-operative mobilization to prevent respiratory complications. Monitoring and surveillance. Implement robust post-operative monitoring protocols. Patient engagement. Educate patients on pre-operative respiratory health and post-operative care. Education and training. Provide ongoing training for healthcare providers on recognizing and managing respiratory complications. These are my citations. Thank you.